Have you watched Root Cause, the Netflix documentary? It's about root canals and the potential subsequent illness that the person that's running the movie blames on that treatment. So this is my analysis of the documentary to help my patients make decisions that are right for them. So if you're one of the many people that have concerns about your existing root canals or possible root canal treatment, watch this. The documentary talks about one man's journey to find answers for his illness. He has not responded to any therapy and his symptoms are getting worse. For those of you who know a bit about me and my own journey to find similar answers, you know that I understand his pain and frustration in trying to get help in order to get better and heal. Though my own journey was not as extreme as Ben's, I do understand that there are many people that struggle like he did with an illness that is not being treated properly. They are suffering, not getting any better, or don't have the answers they're looking for from their doctors. So wanting to know why you have an illness and look for ways to heal is completely normal. In the documentary, they make certain claims and refer to studies to support these claims. For example, they refer to a study that showed that 97% of patients with breast cancer had root canals on the same side as the cancer. There's actually no research to support this statement, and the statement is irrational. It would kind of be like saying 97% of patients with breast cancer drink water, implying that water caused the cancer. You can't just link these two like that. And there are many other factors involved, and a proper scientific study is required in order to determine this type of link. The documentary refers to many studies, so I decided to do some research and read those studies and get the information out to my patients. And here's what I found. There is continued interest in attempting to determine if root canals and other oral disease are factors in systemic diseases. Current research shows that there is strong evidence supporting the association between gum disease and heart disease and a relationship between the health of your mouth and heart attacks. Research also supports a relationship between gum disease and miscarriage and premature births. Scientific studies also support the link between rheumatoid arthritis and decay or cavities. So current research shows evidence that antigen injected into the gums of mice is capable of causing inflammation in the knee joint, and antigen administered through the root canal of primates and rabbits caused both local and systemic immunological response. But further animal studies have also shown that antigen introduced in the root canal elicits a strong immune response, stimulating the production of circulating antibodies. In 1976, a study was done that measured the presence of bacteria in the bloodstream after root canal treatment, and the study clearly showed that if proper aseptic technique was used, which included rubber dam, instrumentation that remained within the root canal space, which is a method that is currently used, bacteremia was not produced. All these studies suggest that the health of your mouth is related to the health of your body. Bacteria in your mouth travel through your bloodstream into the rest of your body. So narrowing it down to root canals only is not taking into account many other factors like gum disease and decay, which play a huge role in overall health and well-being. A reduction in mouth bacteria through proper home care, regular dental cleanings, restoring all broken down and decayed teeth, all the procedures that work to eliminate bacteria in your mouth are key to reducing bacteria present in your body. More research is needed to determine if the cause of illness is due to a root canal treatment or not. It is necessary to determine whether a particular root canal therapy has any residual bacteria and inflammation before proceeding to extractions of those teeth. Gathering patient-specific information, including x-rays, scans, and medical history, is critical to determine how to proceed with treatment. Understanding of each particular illness and getting the history of how and when it started is also a big part of the solution. So to find out more about your particular situation, call us to schedule a consultation.